My name is Bao, and I did my portfolio on chlamydia trachomatis. So, what is chlamydia? Chlamydia is a common sexual transmitted disease caused by infection with chlamydia trachomatis. It can cause cervicitis in women and urethritis and prostatitis in both men and women. Chlamydial infections in women can lead to serious consequences, including pelvic inflammatory disease, tubal factor infertility, ectopic pregnancy, and chronic pelvic pain. So, virulent factors. So, the cell loss of chlamydia has been characterized as gram-negative with no difference. It lacks muriatic acid that is found in cell walls of most other bacteria. This makes chlamydia resistant to antibiotics such as penicillin because antibiotics disrupt the typical cell wall, which does include the muriatic acid. So being gram-negative, it also contains LPS, so that also helps cause damage to the host's body, mainly due to the host immune system. But once inside the host, chlamydia binds salicylic acid receptors, which are usually found in mucus-rich environments. So antigenetic variation is also an important factor with 15 known stereotypes. A disadvantage to humans is that as many as 75% of the infections may be subclinical and asymptomatic. So how do people get chlamydia? So chlamydia is transmitted through sexual contact with the penis, vagina, mouth, or anus, or with an infected partner. So ejaculation does not need to have occurred for chlamydia to be transmitted or acquired. Chlamydia can also be spread perinatally from an untreated mother to her baby during childbirth, resulting in conjunctivitis or in pneumonia in some exposed infants. People who have chlamydia and has been treated may get infected again if they have sexual contact with a person infected with chlamydia. So some signs and symptoms. So chlamydia is known as a silent infection mainly because most infected people are asymptomatic and they lack abnormal physical examination findings. But if they do have any signs and symptoms, one of these are the mainly ones. So painful urination, any abnormal vaginal discharge in women, as well as the penis in men, painful sexual intercourse, bleeding between periods and or after sex in women, and testicular pain in men. So how is chlamydia diagnosed? So there are several diagnostic tests for chlamydia, including nucleic acid amplification tests, cell culture, and others. So as of right now, the nucleic acid amplification tests are the most sensitive tests and can be performed easily. Obtaining specimens such as vaginal swabs or urine. So how do you prevent chlamydia? So the first prevention is to use condoms. So using a male latex condom or a female condom during each sexual contact. Condoms used properly during every sexual encounter reduces but does not eliminate risk of infection. The second prevention is to limit your number of sex partners. So having multiple sex partners put you at a higher risk of contracting chlamydia and or other sexually transmitted infections. Another way to prevent chlamydia is to get regular screenings. So if you are sexually active, particularly if you have multiple partners, talk with your doctor about how often you should get screened for chlamydia and or other sexually transmitted disease. The last prevention is to avoid douching. So douching decreases the number of good bacteria in the vagina, which also can increase the risk of infection. So if you do have chlamydia, there are treatments. So if you're diagnosed with chlamydia, your doctor will prescribe oral antibiotics. A single dose of erythromycin or doxycycline twice daily for 7 to 14 days are the most common treatments and are the same for those with or without HIV. With treatment, the infection should clear up within 1 week.